Hypertension, commonly known as high blood pressure, is a prevalent medical condition affecting millions globally. It is often referred to as the silent killer because it can go unnoticed for years, causing damage to your body without any obvious symptoms. It arises when the force exerted by blood against the walls of your arteries remains consistently elevated over time. This force can be influenced by various factors including genetics, diet, lifestyle, and underlying health conditions. Imagine your arteries as a network of highways transporting blood throughout your body. Just like highways, these arteries need to be clear and unobstructed to function efficiently. When blood pressure is high, it's akin to traffic congestion on these vital pathways. The increased pressure can cause wear and tear on the arterial walls, much like how heavy traffic can damage road surfaces over time. This persistent pressure can damage your arteries and increase the risk of severe health problems, including heart disease, stroke, and kidney failure. Over time, the heart has to work harder to pump blood, which can lead to heart enlargement and eventually heart failure. Understanding hypertension is crucial for early detection, effective management, and ultimately, safeguarding your health. Regular checkups, a balanced diet, regular exercise, and medication when necessary can help manage blood pressure levels. By taking proactive steps, you can reduce the risk of complications and lead a healthier, more fulfilling life. Hypertension is often dubbed a silent killer because it typically doesn't manifest noticeable symptoms until it has already caused significant damage to your cardiovascular system. This insidious nature makes regular blood pressure checks essential, even if you feel perfectly healthy. Understanding the mechanisms behind hypertension is key to appreciating its seriousness. When your blood pressure is consistently high, it strains your heart and blood vessels, leading to a cascade of health issues over time. While hypertension often remains asymptomatic, especially in its early stages, some individuals may experience warning signs. These symptoms can be subtle and easily attributed to other conditions, which is why hypertension often goes undiagnosed. Common symptoms include headaches, particularly in the morning, dizziness, shortness of breath, nosebleeds, and blurred vision. It's important to note that these symptoms are not exclusive to hypertension and could indicate other health concerns. Hypertension's stealthy nature stems from its gradual progression and the absence of clear-cut symptoms in many cases. The human body is remarkably adaptable, and people can live with elevated blood pressure for years without realizing it. This asymptomatic period allows hypertension to silently inflict damage on vital organs, increasing the risk of life-threatening complications. Regular blood pressure screenings are paramount in unmasking this silent killer and preventing its devastating consequences. Section 5. The dire consequences of untreated hypertension. Untreated hypertension is a ticking time bomb, significantly increasing the risk of severe health complications. Over time, the constant pressure on your arteries can lead to a buildup of plaque, narrowing and hardening them. This process, known as atherosclerosis, restricts blood flow, increasing the likelihood of heart attack, stroke, and peripheral artery disease. Hypertension also strains the heart, potentially leading to heart failure, an inability of the heart to pump blood effectively. Section 6. Risk factors. Who is at risk of developing hypertension? While hypertension can affect anyone, certain factors can elevate your risk. Understanding these factors can help in taking preventive measures and managing your health more effectively. Age is a significant contributor, with blood pressure tending to rise as we get older. As we age, the blood vessels naturally lose some of their elasticity, which can lead to increased pressure on the arterial walls. Family history of hypertension also plays a role, suggesting a genetic component to the condition. If your parents or close relatives have high blood pressure, you may be more likely to develop it yourself. Lifestyle choices, including a diet high in sodium and saturated fats, lack of physical activity, and a sedentary lifestyle, can significantly increase your risk. Consuming too much salt can cause the body to retain fluid, which increases blood pressure. Excessive alcohol consumption can also increase your risk. Drinking too much alcohol can raise your blood pressure to unhealthy levels. Over time, heavy drinking can damage the heart. Other risk factors include obesity, smoking, and stress. Being overweight forces your heart to work harder to pump blood, which can increase blood pressure. Smoking damages the blood vessel walls and accelerates the process of hardening of the arteries. Chronic stress can contribute to hypertension by causing your body to produce a surge of hormones that temporarily increase blood pressure. Certain medical conditions like diabetes and kidney disease can also elevate your risk. Diabetes can damage the arteries, making them more susceptible to the hardening of the arteries, while kidney disease can affect the body's ability to regulate blood pressure. It's important to manage these conditions effectively to reduce the risk of developing hypertension. Section 7. Lifestyle modifications. Taking control of your blood pressure. Managing hypertension often involves a multi-pronged approach, with lifestyle modifications playing a crucial role. Adopting a heart-healthy diet rich in fruits, vegetables, and whole grains while limiting saturated and trans fats, cholesterol, and sodium is essential. Regular physical activity, aiming for at least 150 minutes of moderate intensity exercise per week, helps lower blood pressure and improve overall cardiovascular health. Other lifestyle changes include maintaining a healthy weight, quitting smoking, and managing stress through techniques like yoga or meditation. Section 8. Medical interventions. Medications for hypertension. In addition to lifestyle changes, medication may be necessary to control blood pressure effectively. Lifestyle changes such as diet, exercise, and stress management are crucial, but sometimes they are not enough on their own. This is where medications come into play, providing an essential tool in managing hypertension. Several classes of antihypertensive medications work in different ways to lower blood pressure. Each class targets a different mechanism in the body, ensuring a comprehensive approach to treatment. Understanding these medications can help you better manage your condition. These include diuretics, which help your body eliminate excess sodium and water, reducing blood volume. Diuretics are often one of the first types of medication prescribed for hypertension. They are effective and have been used for many years. Beta blockers, which slow your heart rate and reduce the force of each beat. Beta blockers are particularly useful for patients with certain heart conditions, in addition to hypertension. They help the heart to work more efficiently. And ACE inhibitors, which relax blood vessels by blocking the formation of a hormone that narrows them. ACE inhibitors are often prescribed for patients with chronic kidney disease or diabetes, as they offer protective benefits for these conditions. Your doctor will determine the most appropriate medication or combination of medications based on your individual needs and medical history. This personalized approach ensures that the treatment plan is tailored to your specific health profile, maximizing effectiveness and minimizing potential side effects. Regular follow-ups and monitoring are essential to adjust the treatment as needed and to ensure optimal blood pressure control. Section 9. Preventing hypertension, a proactive approach to heart health. Preventing hypertension is far more effective than managing its consequences. By adopting a heart-healthy lifestyle early on, you can significantly reduce your risk of developing this silent killer. This includes maintaining a healthy weight through a balanced diet and regular exercise, limiting alcohol intake, and avoiding smoking. Regular blood pressure checks are crucial, even if you feel healthy, to detect any early signs of hypertension and take prompt action. Section 10. The importance of regular monitoring. Regular blood pressure monitoring is paramount in the fight against hypertension. Because hypertension often presents no symptoms, regular checkups are the most reliable way to detect it early on, when lifestyle changes and medication are most effective. Monitoring your blood pressure allows you to track your progress, identify any potential issues, and make necessary adjustments to your treatment plan in consultation with your healthcare provider. Early detection and management are crucial in preventing the long-term consequences of this silent threat. Section 11. Take charge of your health. Get your blood pressure checked. Today, hypertension is a serious condition, but it's often preventable and manageable. By taking charge of your health, you can significantly reduce your risk of developing this silent killer and its potentially devastating complications. Schedule a blood pressure check with your healthcare provider today, and make heart-healthy choices a part of your daily routine. Remember, knowledge is power, and by understanding hypertension, you can take proactive steps to protect your health and well-being.